Hey there, are you having foot pain in pregnancy or anytime? I can help. My name's Dr. Kelly. I am a doctor of physical therapy, double board certified in orthopedics and pelvic health, and I love helping all people with a pelvis live happier, more fulfilled lives with more confidence in the weight room and the bedroom. And I love teaching simple, effective tricks for getting rid of common but not normal problems like foot pain in pregnancy or anytime. So let's get started with one of the more common types of foot pain, which is arch pain, which is pain in this inner part of your foot right here. Now, this can be from a lot of reasons, but in pregnancy, the main reason we start to develop foot pain here is as we're growing our beautiful baby, every day we weigh a little bit more. And so all of our muscles have to actually be stronger every single day of this pregnancy to support our beautiful changing body. And if we aren't aware of that and the muscles stay the same strength, the foot tends to collapse down, and that gets lots of pressure on this inner arch. It can turn into something called plantar fasciitis, which is a fancy way of saying inflamed bottom of your foot. And if that's the diagnosis, your telltale sign is going to be terrible pain with your first few steps in the morning. And we'll see about the response I get to this. Maybe we'll do another video on that in the future. But in general, just generalized arch pain. And even if you're not pregnant, this can happen from wearing flat shoes or maybe really high-heeled shoes because those shoes kind of create that same situation where the arch gets a little bit too flat. There's a little too much pressure on this tissue of your foot as the day goes on, and voila, suddenly we have pain. All right, so what to do about it? Number one, we've got to unpiss off the tissue. So we can ice with an ice massage. We could use a tennis ball to roll out the foot. We could gently massage around that super sore spot. And there are very specific exercises for coordination, strength, and stretching that are important to kind of fix the root of the problem. And we're not going to get into those. We're just going to get into a quick fix to take the initial pain away, to help you have a better day today, right this second. And that's going to involve kinesio tape or Stark tape, whatever brand of stretchy, sticky tape you have. And make sure it is a big-ish roll and not a pre-cut strip. Okay, so if I have pain right here in my arch, I'm going to take my kinesio tape and I'm going to measure a bit of it from the outer half of my foot to the inner half of my arch. I'm going to cut it off. And then I'm going to round the edges because that helps it stick better. And having proper scissors really matters. I'm using my kids' play scissors right now because I left my good ones at the clinic. Like good sewing scissors would be the greatest. Okay, so we have this one strip that is from middle of my foot around the back of my heel to middle of my foot on the other side. Then we're going to do 2 or 3 other strips that are really quite short. And on the back of any of these tapes, you're going to see squares. So for most of us, these second strips that we're going to cut are going to be about 2 squares long here. Bing, bing. And yes, we're going to round the edges again. Okay, now foot should be relatively clean, no lotion on it. So if you have sunscreen or lotion, just go ahead and wash it off with soap and water and let it dry fully. And then to apply the tape, we tear little lines in this paper backing. That's going to let you access this and pull this back. If you just try to peel it off from the edge, it's kind of a disaster, so don't. And the 2 key terms here is we have anchors are the ends of the tape. And the key is that we don't want any tension on the anchor points. So you know what? I was going to have you go from one end to the other. Never mind. Go ahead, peel all the paper backing off. And we're going to take this eye strip here, and we're going to hold those 2 anchor spots. This is no tension. This is 100% tension. For these techniques, we want about 50 to 75% tension. Fine, 0, 100, 0, 100. Back off just a bit. That's the tension we want. And get sorted here. We're going to try to hold our foot in this L position, not pointed, not way back, but just like an L. Hopefully you're flexible. Here's 0, there's 100%. Let's find that's 50 to 75. We're going to grab right behind our heel, and we're going to pull up the inner and outer border of my foot. And then when I apply the anchors, or that final little bit, there's no tension. And voila, it ends up just beneath my pinky toe and just beneath my big old toe there. That first strip applies like a horseshoe, and it is now going to be what our little 2 tiny strips attach to. So tear the paper backing down the middle, peel it off. And you could be really specific here, like if I just had pain back in my ankle bones, I could just do this back here. But in general, if you have some arch pain, let's just tape the whole arch. You are going to secure an anchor in the outer lower part of your foot, back by the ankle bone, and we're going to pull 50 to 75% all the way around. Voila, we end just above that other strip, anchoring with no tension. Pretty cool, huh? Tear the paper back and repeat, moving one tape width up the foot, anchor with no tension, stretch 50 to 75%, release the tension at the very end, second anchor. Now I have like a women's size 9, so like a 9.5 inch foot, and 2 strips are fine for me. If you have a longer foot, you actually might need 3 strips to get along the arch. But now this taping technique is giving a little bit of support to this whole arch structure, and it will help take a little bit of extra strain off of your painful spot. This particular technique is a modification of a training taping technique called low dye, and some people really like it because it's lower profile, so it doesn't show in cute shoes, etc. If it feels like a little bit better, but you still think you might need more, we could apply a thicker, more rigid athletic tape right on top of this in the exact same pattern. That is amazing. But here's the thing, chicken wing. When we do the athletic tape, that's only going to be good for like a few hours, or like one athletic event, one evening in those cute heels. When we do just the kinesio tape, this can usually stay on if I'm not like doing a major hike, 2 or 3 days. If we do a big athletic thing, yeah, it's going to get sweaty and you're going to want to change it. But if I'm just going around the house or at a busy conference, this could stand for 2 or 3 days, including showers. So I really like it. So this is what I did to help me with my foot pain this week, and I was having the onset of pain. I started taping, 0 pain. That's great. I'm going to keep the tape on for 2 to 3 days, and I'm going to give my skin a break for a day, and I'm going to tape it again. I am also doing some stretching and strengthening re-education along with this to address the root of the problem. Remember, this fixes the symptom, not the cause. Oh, and if I'm pregnant, yes, this will still help address the pain, but those re-education techniques become even more important, because if I get stronger today, that's great, but it's not strong enough for tomorrow, because tomorrow baby's bigger. So we kind of need to be on top of this re-education for the foot and ankle position throughout the entire pregnancy, but also the 4th trimester. In all my pregnancy courses, I do teach you about this neutral foot positioning and stabilization. And in Pregalicious, we also go into some taping techniques, not only this, but others for the foot, shoulder, and even for the tummy and diastasis. So I hope this was helpful, and I'm so glad you're here. Let's get on to living life with less foot pain.